Welcome to today's learning resource, which will discuss the assessment of diabetic foot infections. Foot infections are a common and serious problem in people with diabetes. Infections can present in different ways and to varying levels of severity. Foot infection in diabetes can involve bone, become systemic, and be limb or life-threatening. Therefore, fast and effective detection and management is vital. In today's video on assessment of diabetic foot infections, the following topics will be discussed: how diabetes influences infection, the steps to performing an accurate assessment, the signs and symptoms of infection, and assessments that should be conducted. Diabetes mellitus is an immunocompromising condition. Therefore, it increases a patient's risk of infection and leads to poor prognosis, poor patient outcomes, and increased patient psychosocial toll. It is key to be aware that when managing patients with diabetes to understand that they are more susceptible to infection due to their immunocompromised state. Diabetes may also mask classic signs and/or symptoms of infection, such as experiencing pain or tenderness, due to the presence of comorbidities such as peripheral neuropathy. The presence of peripheral arterial disease may also mask classic signs and/or symptoms of infection, leading to a decrease in erythema and temperature. Thus, clinicians must be aware of the patient's medical history and how it may impact on the presentation of an infection.
Before a diabetes patient's foot is assessed for infection, certain steps must be performed to ensure an accurate assessment. This includes gaining a thorough patient history concerning a previous infection, ulceration, and/or amputations, as well as gaining information on patient's medical conditions and medication, which might influence the presentation of an infection and/or impair the patient's ability to fight an infection and heal. By gaining a thorough medical history, it assists in determining the patient's risk and likelihood of an infection. Step 2 to performing an accurate assessment involves cleansing the suspected infection site with sterile saline and debriding all non-viable tissue in order to visualize the area effectively. From this, the depth of the tissue involvement can be determined. Vascular supply should always be determined prior to sharp debridement. Step 3 to an accurate assessment is that if an ulcer site is present to assess it, utilizing a time acronym to assist in determining if an infection is present. Infection and inflammation are a part of the time acronym, with signs and symptoms of this to be discussed in later slides. The ulcer presentation should be documented, and the ulcer should also be measured to assist in monitoring progress. Step 4 to an accurate assessment involves performing a probe-to-bone test clinically to help determine the depth of the tissue involvement in order to determine if the osteomyelitis is suspected.
It is recommended by the Infectious Disease Society of America that clinicians should consider the possibility of infection occurring in any foot wound in a patient with diabetes. Evidence of infection generally includes classic signs of inflammation and purulence, being local swelling or induration, erythema, local tenderness or pain, local warmth, and/or purulent discharge being thick, opaque to white, or sanguineous secretion. However, infection can also include additional or secondary signs being non-purulent secretions, friable or discolored granulation tissue, undermining of wound edges, and/or foul odor. These signs and symptoms of infection should be thoroughly documented to assist in monitoring the progression of the suspected infection. Clinicians should be aware of factors that increase the risk of diabetic foot infection, and especially consider infection when these factors are present. These include a wound which the probe-to-bone test is positive, an ulceration present for more than 30 days, a history of recurring foot ulcers, a traumatic foot wound, the presence of peripheral vascular disease in the affected limb, a previous lower extremity amputation, loss of protective sensation, the presence of renal insufficiency, or a history of walking barefoot. Infection should be defined clinically by the presence of 2 or more classic findings of inflammation or purulence. The infection should then be classified by severity, being either mild, which is superficial and limited in size and depth, moderate, being deeper and more extensive, or severe, which is accommodated by systemic signs or metabolic perturbations.
Along with the assessment and classification of infection, a vascular assessment must be conducted, as ischemia might increase the severity of any infection, and the presence of the critical ischemia often makes an infection severe. A vascular assessment will thus assist in determining which patient should be hospitalized, which might require special imaging procedures or surgical intervention, and which might require amputation. The Infectious Disease Society of America also recommends performing a neurological and biomechanical assessment to gain further detail on the patient's presentation.